All right, everyone, thanks so much for joining us. We have some folks from UC Davis here today to talk to you about some of their health careers. So go ahead and start.
Great, thank you. Well, thank you for the opportunity to meet with your students, and it sounds like there might be some alumni and other folks participating today. We'll do introductions momentarily, but we wanted to start by just really framing this presentation as a opportunity to not only learn a little bit about UC Davis Health, but really just about healthcare careers in general. So Mario and I will share a little bit about our backgrounds, the work that we do, and we really wanted to articulate this as not just like a sales pitch about why you should work for UC Davis Health, which you definitely all should, but really trying to equip all of you with some skills, knowledge, insight that will be helpful for you as you advance in your professional career. So with that, we will jump into introduction. So my name is Lyndon Hewling, and I am the manager of our Leadership Recruitment and Diversity Services office at UC Davis and UC Davis Health. So what my team does is we oversee all of our executive level recruitments for both campuses. So we fill lots of leadership positions in the healthcare field, but also in the education field on the Davis campus. We also oversee our diversity initiatives for human resources, and that's a lot of stuff. We do a lot of policy work, a lot of advocacy. We do a lot of process improvement and collaboration across the university and the healthcare side. And then we also do a lot of outreach. So we spend a good amount of our time doing presentations like this to students and alumni who are interested in industry. And we do a lot of community partnerships as well. So we go to community events, job centers, employment development spaces to just talk to folks about best practices to stand out as a candidate and put your best foot forward when you apply for a role. And then I also wanted to share that I am a UOP alumni. So I got my master's a couple of years ago. My background is actually in education and educational leadership. So I got my master's from UOP in educational administration with an emphasis in student affairs. So definitely a proud Tiger. With that, I'll pass it over to Mario.
Well, hello, everyone, and thank you for joining us today. My name is Mario Aguizabal, and I am one of two senior talent acquisition partners in leadership recruitment and diversity services. My career at UC Davis Health started over 10 years ago, and 7 of these years have been in talent acquisition. Prior to UC Davis Health, I worked for the Contra Costa County Office of Education for 15 years in human resources. So that's me.
Great, thank you. All right, so like I said, we're going to talk a little bit about UC Davis Health because that's where we work. So we wouldn't be doing justice if we didn't do our pitch and talk a little bit about the university and the medical center and the work that we do. And then we'll jump into some other topics as well.
And I just wanted to just share with you about UC Davis Health and why UC Davis Health. Why do you want to work here? In a nutshell, we are the only level 1 adult and pediatric trauma center in inland Northern California in the Central Valley. We are nationally ranked in multiple specialties, rated Sacramento's top hospital. UC Davis Health is home of the nationally ranked Children's Hospital, top honors for nursing excellence, those that are clinical. We are Magnet recognized hospital, patient-centered primary care model, and we are honored for technology that improves patient care. This is why UC Davis Health is an applicant's first choice when searching for employment in Sacramento.
Great, thank you. And then I very briefly want to just talk a little bit about some of our diversity initiatives as well. So, in addition to the many points of pride that Mario articulated around the healthcare we provide, the community impact that we have. Another important part of our identity is our commitment to diversity and having a diverse workforce. And what really drives that is not only, our mission and vision as a public university, one of the leaders in the state of California, but really also understanding, physically where we're located in the Sacramento region. So our hospital is located in an area called Oak Park, which is a very underserved community. And we've dedicated ourselves to providing healthcare specifically for, not only folks across California, but really keying in on improving health outcomes for the diverse community that surrounds the hospital. So we're thinking a lot about ways in which we can have a workforce that reflects that diversity, as well as thinking about job mobility as well. So the university has positioned itself as an employer of choice and an economic engine in the region. So not only are we looking to serve our patients, but we're also looking to put a lot of our local community members to work. So when I talked about that focus on community outreach, that's really a driver behind that. So certainly looking to hire both locally and nationally. All right, so that's enough about us. What we wanted to do was a quick poll, and we don't actually have a poll. We're just going to use the chat line. But what we wanted to know from those of you that are on the line is what you're interested in. So tell us a little bit about the kind of healthcare roles or courses of study that you're taking. Give us a little bit of insight about your interests. Great, I see primary healthcare. Oral surgery, dentistry. I just went to the dentist this morning.
Radiology, I can see radiology as well.
Mhm.
Pediatrics.
Awesome, so good mix. Kind of all across the board there. All right, and if folks come on later, they can definitely hop in and answer that question as well. All right, so before we jump into those healthcare roles, what I wanted to talk about first was just provide you a little bit of insight about UC Davis Health specifically. So if you are interested in applying for a job with the university, we wanted to let you know where to do that, whether it's now or in the future. And certainly something that I recommend for those of you that are just starting to wrap your head around the types of career opportunities that are available to you, you could definitely go to our website and just type in different types of roles, or you can type in very specific jobs. So if you're interested again in radiology, pediatrics, oral surgery, just using that search function to see the types of opportunities that pop up can be a great way to get a sense of, where those roles are, the types of requirements that you might need to meet in order to be qualified to work at UC Davis Health, or, do it for other industries. Maybe you're interested in working for Kaiser or Sutter or at another university, taking the time to really explore the job site to get a sense of where your background, where your degrees are going to align with career opportunities that are available to you. And then what we're not going to do for this job talk is actually walk through how to apply for jobs, because we don't think that's necessarily at the forefront of everyone's mind. But we do have a great tool, if you are looking, or if you're talking to a friend or a peer that's looking for a job, we have a great resource that's on our Job Talk site on the HR website for UC Davis that does walk you through the steps on how to do that. All right, so with that, I'm going to kick it back to Mario now, who's going to talk a little bit more about healthcare careers.
Thank you, Lyndon. So we have included on here a few of the highlighted academic programs offered by UOP. And many of the undergraduate, graduate, and professional degrees offered coincide with the degree requirement for positions we hire at UC Davis Health. So that's a great advantage that the University of the Pacific offers these programs. Next slide, please. Next slide. Thank you, Lyndon. As you can imagine, it takes a lot of employees to run UC Davis Health. You can see on this slide the variety of departments and positions that compose our workforce. Employment opportunities in a health system is not limited to doctors and nurses, but we also employ non-clinical positions in hospital administration, clinics, finance, human resources, risk management, compliance, IT, and this is just to name a few. Employment opportunities at UC Davis Health vary from entry level to skill positions requiring advanced degrees. Next slide, please.
Well, I think the point that we really want to articulate here as well is that oftentimes when people think about healthcare careers, they think about nurses, they think about physicians, and that's really, when I talk to folks in the public, that's really all they have that sense of. And so what we want to highlight is that the types of opportunities are broad. And I know Mario will go into more in depth about the diversity of positions that are available. But the way we really like to talk about it is, any role that you would need to run a small city, we probably have. So again, everything from facilities to support roles to leadership roles across the organization.
Correct. Thank you. And these are just a few titles of positions we hire at UC Davis Health. As a matter of fact, some of these positions were recently posted on our website or have been filled by our team or are currently posted. These positions are housed in hospital administration, as I mentioned before, School of Medicine, School of Nursing Administration, Research Office, IT Administration, etc. The Director of Experience Design, which is one of the positions listed on here, is a position that I have recently been recruiting for. And just to put things into perspective, the education requirement for this position is a bachelor's degree in business, which I see is one of the degrees that is offered by University of the Pacific. So that's great. Next slide, please, Lyndon. Here are additional position titles at UC Davis Health. For those of you who are pursuing a degree in physician assistant, UC Davis Health offers an advanced practice fellowship program. I don't know if those that are here that are in the physician assistant program has looked into this program. The UC Davis Advanced Practice Fellowship Program is designed to support new graduate physician assistants in the clinical first year as you transition into practice. The program's primary goals are to help you develop relevant practical skills in critical thinking, evidence-based practice, and procedural skills in your area of interest. I will be including on the chat a link to pertinent information about this program and how to apply. So again, if you're looking into starting a career in physician assistant, we have this robust advanced practice fellowship program that will help you gain that additional experience, a year of experience. You can either stay with UC Davis Health or you can take that experience and work at another facility, but at least will give you the foundation to become a well-rounded clinician. Next slide, please, Lyndon. Volunteering at UC Davis Health is an excellent way to learn more about our culture and network with colleagues and hiring managers. Many students from colleges and universities in close vicinity to the hospital actually volunteer during the holidays or summer, or while not in school, or even in the evenings. If interested in volunteering, you can select the area, the department or specialty in the hospital you wish to be placed. The contact information for volunteer services is listed on this slide. And just to note that due to COVID-19, the office may not be open, but you are welcome to call and leave a message with your interest to volunteer. We have had many volunteers come through human resources and eventually use that network or the experience to venture out into other areas in the hospital or even stay within human resources. So it's a great way for you to network, like I mentioned, to gain additional skills while you're in school. Again, that is a great way for you to do so.
Yeah, it's a great, it's a great resume builder as well. We find a lot of students in particular will take advantage of the opportunity to volunteer, like Mario said, during summertime, or even on weekends. I know Stockton is not terribly far from Sacramento. So it's a great opportunity, whether it's at UC Davis Health or elsewhere, to really, beef up your experience and have pieces that you can make reference to during an interview, or if you're applying for an internship, saying you have that hands-on experience or that shadowing experience can be really beneficial. So a lot of students don't know about these volunteer initiatives that are out there. And, some people like to volunteer just because they want to volunteer. They want to do it as community service or to give back, but you can definitely leverage that as a career advancement opportunity as well.
Yeah, and I just want to emphasize too, Lyndon, that again, students with close vicinity or colleges with close vicinity to the hospital take the opportunity to network, and I think that's a great way for you to make yourself known to the hiring managers and to other colleagues that may be a reference to you when you apply for positions at UC Davis Health.
Great, thank you.
Mhm.
All right, so what we're going to do next is we're going to talk a little bit about really strategies to stand out as an applicant when you're looking for positions. So what we wanted to do is provide you with sort of a peek behind the curtain. So Mario is, lifelong recruiter. He's been doing this work in healthcare for many, many years. I've been in my role for about 2 years, so I can speak to it a bit as well. But what we find is often helpful is providing perspective from our roles, as people who are going out to find, talent for healthcare positions, leadership roles, what we're looking for. So what we want to do is give you some insight and some strategies to consider is you're beefing up your cover letters, thinking about your resumes and how you want to best position yourself to be successful when you're looking for that next job or that first job. So the first thing I wanted to share, I always like to start with cover letters. You'll probably receive very mixed advice about whether or not you should do a cover letter. I don't know what the official position of UOP, Internship and Career Center, is in that area, but what I can tell you for UC Davis is that they're something that we really do value. The way I like to talk about cover letters is that, so UC Davis has a great brand. So we're very fortunate that we get lots and lots of really good candidates for most of the roles that we have. And what the role Mario and I have is to ultimately look at that applicant pool and then make some decisions about, who we want to move forward, who among the qualified candidates makes the most sense to present to the hiring manager so they can then decide who they want to interview and hire for that job. And that cover letter is a really unique opportunity for you to stand out. So what I don't recommend is like the generic cover letter that says, "Dear Sir, Madam, I'm interested in your job. I'm great, hire me." What it really is a great opportunity to highlight why you're interested in that position, in that organization, and sell yourself. And think about it from your perspective. If somebody was applying to work for you, what's going to stand out is somebody who really takes the time to tell you why they want that job. Whether it is you're applying for lots of jobs or really just that one job, it's important to customize that story in order to stand out. If I have 10 qualified candidates that based on their resume seem to be about the same, how am I going to make that determination about who I want to bring forward? That cover letter can be a really great way to do that. The other piece I like to highlight about the cover letter is that you can really contextualize who you are as a person. So at UC Davis, we really do take a lot of pride in the diversity of our workforce, the leadership that people bring to these roles, their volunteer services, all of these things that make you the person that you are, but can be hard to capture on a resume. So a cover letter is a great place to tell that story for us. We also think it's a great place for you to describe any relevant experience that you have. So in a minute, I'm going to talk a little bit more about how recruiters screen and make determinations about who to consider. And sometimes you might see a job where, there's 10 qualifications and maybe you meet 8 of them, but then there are 2 that you're a little fuzzy about. You can use that cover letter as a way to speak to that. How is that experience relevant? How is it equivalent? How have you met the requirements for that role, even if your resume seems to suggest that you meet most of it, but not all of it? So I really like to prop up the cover letter as an opportunity to tell your story and to use it very strategically to stand out as a candidate. And then obviously your resume is huge. Again, we get lots and lots of resumes at UC Davis Health. It's something we require as part of your application. And again, it's something that needs to be tailored and used strategically to make you stand out as a candidate. So at the bare minimum, especially in the healthcare industry, it's important that you take the time to spell out your years of experience, specifically if you have degrees or certificates or oftentimes license. In healthcare, many positions require very specific types of license or qualifications. And we get lots of applicants who apply and then they forget to put that the certification is active or how long that license is valid. And those are small things that end up becoming reasons we can't move somebody forward, because we can only consider people who meet the minimum qualifications. And that small little piece can often be something that ends up being a hiccup or a snag in your qualification. So taking the time to spell that out and tailor your materials to that resume or to that role.
And one thing too, Lyndon, that I want to point out as well here, that don't assume that because let's say that you're a physician assistant, that we assume that we know that you have a physician assistant certification. So you need to include that on the on your resume or on your application that you have the certification, or ACLS or PALS, any of the certifications that are required in the job description need to be included here as well. Don't assume that because you're doing the work or you went to school for that, that we know that you have that certification.
Yeah, I'll talk to people and they'll apply for a job as let's just say a librarian, and they're currently a librarian, and they don't get an interview and they're like, I don't understand. Like, I'm literally doing the job I'm applying for. And the feedback I provide is, I look at the resume and 9 times out of 10, they didn't take the time to customize their resume to the requirements for that specific job. So to Mario's point, you don't want to assume because we don't know anything. And we are very much guided by those job postings. So you need to align your experience with what we're asking for. So again, I alluded to a lot of this, just some basic things that I'm sure you cover in some of your courses and the support you get elsewhere, but it's definitely having up-to-date contact information, skills, the license I spoke to. And then I also wanted to articulate that, at least for us, we're not really wedded to this idea that your resume should be 1 page, or that if you go to 2 pages, you're doing something wrong. At least for UC Davis Health, we would rather you take the time to spell out your qualifications and the breadth of your experience, as opposed to truncating things or pulling things out for the sake of just getting everything down to 1 page. And to that end, I also wanted to highlight that in addition to your experience, we do like to see the leadership and, again, the volunteer services, the diversity experience, and taking time to pull that out. For many of you, you're probably involved in student organizations, other leadership initiatives, especially early on in your career. Those are great ways to beef up your resume and to stand out as a candidate. So our advice isn't to shy away from that type of content on your resume. For us, it really provides a more holistic perspective of who you are. Here's a resume. I'm sure you do a lot of work with resumes, so we won't go into too much depth about that. But certainly understanding the piece we like to make here is that when we talk about screening, so to take a step back, when Mario has 20 people who have applied for a job, what he's going to do is he's going to open up every single resume. He's going to take a look at it. And then basically what he does is he puts people into the no pile or into the yes, let me take a further look pile. And what you want to do as an applicant is make sure that it's really easy for Mario to put you into that, yes, this person meets the minimum qualifications, I'm going to look at their resume further pile. So what our recommendation is to ensure that you are putting the most relevant information right at the top of that resume. So what I used to actually have on this screen was the picture of just like the top third of a resume, because that's what the recruiter is going to look at. They're going to open it up. That PDF is going to be really big. They're going to see the top half of that resume. And what you want to do is make sure that right away, if you have the experience, that's right there. So if your relevant work experience was maybe a job ago or 2 jobs ago, you can easily rearrange your resume and make it not chronological, but put the relevant experience up there first. So we can see that you have the skills to do that job. So again, it's about tailoring your materials to the position and then thinking just from like a human nature standpoint, how do I make it as easy as possible for this person to know that I can do the job and that they should take a closer look at my materials?
And Lyndon, many of our positions require a number of years of experience. For example, 7 years in customer service, for example, 5 years in with customer service experience. Make sure that you include dates on there to ensure that we are able to count the years of experience that you have. I've seen many resumes come through, and under relevant employment experience, they just put the organization that they work for, but no dates. So we're not able to make sure that you have or that you meet the minimum qualifications of the number of years that are required. And also for the education, I mean, if you are still in school and will be graduating, as you can see on this example, anticipated June of 2021, many cases, there's no dates on there. So we cannot assume again that you have graduated or will be graduating. So that's very important that you include the dates of graduation on there as well, or anticipated date of graduation.
Yeah, and the way to think about it again is, I use the example of Mario getting 20 applications, but in reality, it's more like 100 applications. So, the recruiters don't always have the time. You're going to find this anywhere to do the follow-up, unless you're absolutely a stellar candidate, and the only thing we can't infer from your resume is if you graduated in 2000 or 2001, and that's relevant to the role. They may call you up, but for the most part, if we have lots of qualified candidates for these jobs, you're more inclined to be put into the not qualified pile than have them reach out to you and try to get that little piece of clarification. So that's the reality of the process. And again, what it speaks to is the importance of customizing your materials. And that's going to be your best strategy to be successful as an applicant, whether it's at UC Davis Health or anywhere else, especially in healthcare where things are very specific. Years of experience matter so much, license matter. It's taking the time. It's a job to apply for jobs. But once you get the job, you're gold. So you do the work on the front end, and that's the best investment of your time. This approach of just kind of throwing a generic resume out into the wind, it just doesn't work. It's not as effective as spending the time to applying for a couple of jobs that you're qualified for, as opposed to applying for 50 jobs that you may or may not be qualified for without customized materials.
And Lyndon, just to also include with customizing your material, if you're applying to multiple positions, make sure that your cover letter you attach the correct cover letter to the job that you're applying. We get so many applicants that just throw the same resume and cover letter for all the positions. You may be applying for an IT position, but then we get a cover letter for a experience design director, and the manager's not going to even look at your application anymore, although you meet them in qualifications, because your interest based on the cover letter is for an IT job, not experience design. So that is very critical for an applicant to make sure that the cover letter it's tailored and relevant to the position that you're applying.
Great. All right, so to close things out, I talked a lot about this. The one piece of insight that I'll provide specifically about applying to a public organization versus a private organization is that typically what you'll find in the public center, and UC Davis and UC Davis Health are an example of that, we're public institutions, is that our hiring processes are actually very standardized. So we probably made the point clear, when you're applying for a job, we're very much guided by what's on that job posting, specifically in those minimum qualifications and preferred qualifications. And there isn't a ton of wiggle room in terms of interpretation or seeing somebody who looks like they have potential but don't have the experience, because we have to make sure that every hiring decision we make, can be defended. And that's good for us as a public university. We're funded by taxpayer money. We have to be accountable to equity in our process. Whereas if you're applying for a job in the private sector, you might find that there's a little bit more flexibility in their willingness to bring somebody on who's maybe a little less experienced or has most of the qualifications and kind of take a chance on them. So that's why we wanted to provide that insight about our perspective as a public university and how we do things compared to maybe some other organizations that you're looking at that may or may not have quite as rigid a process for consideration. So then what I also want to talk a little bit about is LinkedIn, and I know Mario will jump in as well. He's kind of one of our LinkedIn gurus. He's the one who helped make my LinkedIn so wonderful. So I bow down at the shrine of Mario when it comes to this, but I just want to touch on some key ideas and some key strategies for those of you that have a LinkedIn or are thinking about building up their LinkedIn. And to take a step back, the reason we really highlight that particular social network is because for us, that's where we go out and look for talent. So other organizations might use different approaches, but for UC Davis Health, and definitely in the healthcare industry, LinkedIn is kind of the place to go to find those qualified candidates. So your LinkedIn can be another really strategic tool to stand out as a candidate and to have people like Mario and I be able to come find you. Because in addition to getting applications, part of our work is to go out and find great, talented people who meet the qualifications that we're looking for. And again, in healthcare, it's very niche. You know, sometimes we need to find a nurse who can cut livers and do backflips and speak Spanish. Like, you know, we have some very specific needs. And if you have those qualifications, your LinkedIn is a good place to highlight that. So I know before I joined staff recruitment, I had a LinkedIn and it was just a picture of me. It said I was great. It had a list of my jobs, and that was really it. And what I've learned is that LinkedIn is actually a really powerful tool, like with their algorithms, their search functionality, the keywords, all this magical stuff that recruiters can do on the back end to go find very specific people for jobs. So this insight is meant to give you some strategies to do that. So one of the big things to know, besides obviously having a photo, is that the way LinkedIn works is it pulls keywords from your profile. So you want to ensure that you have not only, you know, any job experience on there or educational experience on there, but if you're specializing in a certain field or you have a certain license that you know is really important to your industry, or there's something about yourself that you want to emphasize, like maybe it's leadership or diversity, or you're a member of a certain professional organization, you want to make sure that those things are weaved into your profile where it makes sense. Because when we're searching for people, we type in these keywords and it's going to pull up all the profiles that have the people that meet the search criteria. And the way it works is that it looks for that combination as well. So if you can cut open kidneys and you're a nurse and you have the license and you speak Spanish, you're going to be the first person I see when I do that search. So the more you can include in there, the better. You're also encouraged to add recruiters. You know, if there's a certain place you want to work, whether it's UC Davis or just in the healthcare industry somewhere in California, or at, you know, Kaiser, South Sacramento, whatever, you know, whatever it is that you're interested in, go find those recruiters and add them and let them know that you're, you know, a qualified candidate for the kind of roles they may be looking for. Your experience on LinkedIn should also be distinct from your resume. So your LinkedIn is really a consolidated snapshot of who you are and your professional experience. It shouldn't just be your entire resume cut and paste onto the LinkedIn. But you do want to make sure that those key qualifications stand out. So I'll stop there before I go to the next slide to let Mario jump in and add anything else he wants about LinkedIn.
Yes, one other thing that I want to mention about LinkedIn is that on your profile, you can select that you are looking for new opportunities. And there's a check that you can do that you're looking for new opportunities on there. And just to give you some insight, as a recruiter, when I search, for example, pediatrics, or let's say an administrative director for pediatric services, I get a list of everyone who meets that specific criteria. But I also have different columns. Everyone that meets that criteria, those that are open for new opportunities, and those that are actually have applied or have looked at UC Davis Health in the past. I'm going to start with those who are looking for new opportunities. So if you check that you're looking for new opportunities, you will be one of those individuals that I'm going to look at first before I go to the other columns that LinkedIn has provided me with. So if you're looking for new opportunities, make sure you check on your profile that you're looking for new opportunities. And for the experience, just make sure that your resume mirrors your LinkedIn profile. If I'm looking at your resume, if I'm looking at LinkedIn, it needs to, I want to make sure that I'm looking at the same person, not completely different individuals. It's important for you to make sure that somehow doesn't have to be exactly the same as your resume, but somehow mirrors that experience as well.
Yeah, because we'll use that search functionality. And if you, like, say you made a LinkedIn profile for a class assignment and then you never updated it again and your name is, you know, Sally Jones, there's a lot of Sally Joneses out there. And I'm not going to know which one is you unless, you know, I'm looking at your resume and it says that you have a year of experience doing this thing and your background is in that and your educational degree is this, and those key details align on your LinkedIn. So take the time to do that, if nothing else, when you're, especially, you know, if nothing else, when you're applying for jobs or when you're actively using the platform to network, ensuring that that information lines up and is congruent. The other thing that I'll say about LinkedIn is that it's important to have a robust profile there because, you know, especially for UC, you know, we make a point to not look at other social media platforms. You know, we're not going to go look at your Facebook or your Instagram or I don't know, the TikTok, whatever the youth are using. So ideally your LinkedIn will be the first thing that pops up when I search for your name, especially if you have a really unique name. There's not a lot about you out there. That LinkedIn is sort of designed to be the first thing that pops up if you have it, when we're looking to find information about candidates.
LinkedIn also offers a training on how to create a robust profile. So I would encourage you that if you have an account, you go into the education component of LinkedIn and select how to create a profile. And it will walk you step by step how to stand out as a candidate also too on LinkedIn. And in addition, just to, we are developing a series of job talks, and one of the series is going to be how to create a LinkedIn profile. And we can provide that information to you later because we're going to go step by step on how to create a profile as well.
Cool. All right, so the next page is a screenshot of a LinkedIn profile. So this is our other recruiter, Ellen Jordan, who's doing another job talk today elsewhere. And there are just a couple things we wanted to highlight. So the friendly face, obviously, but more importantly, one of the things I want to highlight is how she has her keywords right under her name. So a lot of people will just put their job title there. Her job title is Senior Talent Acquisition Partner, which I know what that is, but a lot of people don't. You know, it's a recruiter, but we use the term Talent Acquisition Partner. But what she wants people to know about her in terms of searching for her on LinkedIn and her algorithm are these key aspects of who she is. So obviously she's an HR professional. She works in talent acquisition, but she's a recruiter because not everybody's going to search for talent acquisition partner. Some people, if she's looking for a job, may just type in recruiter. So she wants to have that in her keywords. She works in diversity services, and that's obviously a very unique experience to be doing formal diversity recruitment efforts. So she's going to highlight that. And then she has a really extensive nonprofit experience, community engagement experience. And so she's taken the time to customize her materials to that end. And then you see that reflected on the other side in the about. Those are keywords. It isn't just a cut and paste of her resume. Her work experience is below there and later on, but those are all things that she wants associated with her brand, for lack of a better term, on LinkedIn. And then she has her years of experience. She has a budget that she's managed. These are all things that make Ellen stand out among the thousands of recruiters that are out there on LinkedIn now, perhaps looking for a job. So taking the time to really customize and highlight who you are. And then one thing we didn't touch on too much was endorsement. So that's a great other area that you can focus in on, is connecting with other people that can speak to your experience. So one of the neat things again about the algorithm is that, so if you look on there under healthcare, Ellen has 54 endorsements for healthcare, which is fantastic. She works at UC Davis Health and UC Davis. And she's also been endorsed by people that have also been highly endorsed in that area. So that actually props you up. If there are people that have a lot of really good experience in an area, if they're also saying you're really experienced in that area, that's going to stand out more so than folks who don't have a lot of endorsements. So it's kind of this internal LinkedIn collateral that you can use to really highlight your experiences and what unique qualities you can bring to a role. And then the last piece, so you don't see it on Ellen's page because she's not actively job searching, as far as I know. If you're looking for a job and a recruiter is looking at your profile, there's a little thing that's on your profile that says open to new opportunities. So it's like a little symbol that recruiters know to look for if you are actively job seeking. So to Mario's point, you definitely want to have that turned on if you are looking for something. And some people even put that in their header. They'll say looking for jobs, or they'll say I'm looking for internships, or some people even go so far as saying, you know, looking for opportunities in Texas and Colorado. So whatever you want to have on there to help folks know what your interest is, you can use LinkedIn for that.
And also too, Lyndon, just to point out that Ellen shares her story in previous job talks that when she was hired at UC Davis, a recruiter from UC Davis actually found her on LinkedIn. She was not looking for a job, but because of her experience and whatever and all the skills that she brought, someone from UC Davis contacted her via LinkedIn, and now she's working for UC Davis. So it works.
Yeah, we stole her away. That's what we do. That's literally our job, steal people away. And then the other piece I'll add too, so I think I alluded to it earlier, but taking the time to connect to recruiters and other people that work at the organizations that you're interested in just helps you get in front of those folks. So some people will ask me, you know, should I send a LinkedIn message to the recruiter if I applied for a job? It doesn't hurt to do that. They won't always reply, you know, especially at, again, a public university. We have to be very careful about not giving like preferential treatment or giving the perception that we're biased at all. But by getting connected and sending that message, you know, we know that you're looking. And especially in fields where it's hard to find qualified candidates like healthcare, being connected just gets you in front of that recruiter. So maybe you're not applying for a job now, but down the road, you know, you want to work for that organization. You're going to be part of our network and you're going to see any opportunities that we post on our feed, or you're going to pop up quicker in our algorithm because you're connected to us. So it never hurts to use the tool for networking, even if you're looking for jobs in the future. So I know for many of you, again, you're not going to end this call and then start applying for jobs, but it doesn't hurt to start now and building that network, getting yourself out there in order to be more visible.
And also to Lyndon, one of the things that I use is to, especially with LinkedIn and individuals that I connect on LinkedIn, I develop a pipeline of candidates that may not be looking right now for positions, but may in the future. And if a position becomes available that I find that meets the qualifications, I will contact them on LinkedIn and say, hey, this is a great opportunity that I think you meet the qualifications. I will encourage you to either call me, we can talk about this position, or apply for the position and give them the direct link to the posting. So even if you're not looking for a position right now, if you connect with a recruiter, other recruiters do the same. They create pipelines that can be used for future positions that may become available.
Yeah. And it doesn't hurt to say no. You know, if somebody reaches out to you and you're not quite ready, you can just say that, like, hey, you know, thanks for considering me. This is definitely the type of role I'd be interested in, but I'm not looking to move to Alaska or what, you know, whatever it is at the time that makes you not interested in that role. There's a couple search firms that will reach out to me about opportunities, and they're always all over the country, and I'm not looking to leave California anytime soon. So, you know, I always reply. I say, thank you for thinking of me. You know, I definitely am interested in this type of role, but not right now. Please keep me in mind for, you know, future opportunities. And if I'm interested, I'll let you know. You all are graduating from UOP, so you're going to be in high demand. So at some point in your life, people will be reaching out to you. Okay, so with that, we wanted to leave about 15 minutes for any questions. There's lots more that we could have gone into, but we wanted to really provide that high level insight into the types of careers you might want to consider, some insight into the application process and strategies to stand out as a candidate. And then lastly, just some tips and suggestions to give you some action items after this to really beef up your LinkedIn profile, and then also perhaps take a closer look at your resume and your experience. So with that, we'll stop talking and answer any questions that anybody has. And if you want to be really specific, you can. I don't think we have a ton of people. So Mario in particular is a great resource when it comes to really random healthcare jobs that you might be interested in.
I did have one quick question. I know you talked about the volunteer experience. Is there certain areas of the hospital that where you can volunteer, or is it pretty much any area that you're interested in has volunteer opportunities? Because I know some students that might be interested in
Right. So
that
any
experience.
area, it's open to take volunteers. You will just need to let volunteer services know what specific area you're interested in. Any of the inpatient units. I do know that the NICU has a great volunteer program where they allow volunteers to come into the nursery and hold the newborn babies that need to be held. So that's a great way that I'm signing up for that, and I'll be doing that pretty soon. It's just such a caring thing to do. But also other areas as well, even in human resources, like I mentioned, not just in the hospital, but the clinics or hospital administration will take volunteers to help with the process, or even shadow.
Okay. Great, thank you.
Mm-hmm. And I did see
a question about research careers offered at UC Davis. So Mario, I don't know if you want to talk anything about like lab roles or things like that.
Well, we do have many research career opportunities at UC Davis. I don't have exact examples right now of positions that may be available, but if you connect with me, let's see on LinkedIn or even via email, we can go more into details about research career opportunities, both at health and at campus in the different schools that we have available. So we can go more in depth about that.
Yeah, so I wanted to mention, we're talking all about UC Davis Health, but certainly at the Davis campus, there are many healthcare-oriented positions. So one actually really interesting industry that I've learned a lot about is technology commercialization, which is not a combination of words I ever said before I had to recruit for a job in the Office of Research. But what they do is they actually take the research that faculty are doing, in all industries, whether it's biology, we have like a big agriculture industry, veterinary medicine. So what we do as the university is we take that research and we have a whole team or series of teams that look at how to turn that research into products, or how to commercialize that research. So they'll take some breakthrough, some new chemical that does some cool thing to your cells. And it's great to have that, and that advances learning, but the university will also spin that out into a product or a startup or a business that then benefits that researcher in the university. So there's this whole other industry of it's sort of the nexus between like research, science, and then business and commercialization. That's really a budding industry in a lot of organizations. So again, when we think of healthcare, we think of doctors and nurses, but there's so many other arenas in which folks can find healthcare roles that will really blow your mind if you take the time to research it and sort of look at the way healthcare operates. So I just wanted to mention that one in particular because I think it's really interesting to kind of think about the end product of research and the kinds of things that we do with that.
Oh, hi, I just had a question. Thanks for presenting to us today. And I was just wondering, like from your recruiter's point of view, Like, is it a red flag if an applicant is applying to multiple jobs at the same time, or is that fine?
Well, Justin, I don't think it's a red flag. It will only be a red flag if you're applying for positions that you're not qualified for. But definitely, if you're qualified for those positions, we encourage you to apply. I mean, we have hundreds of applicants that apply on a daily basis for positions, and you may not be selected for the first job that you applied, and we encourage you to continue to apply. So if you're qualified, if you meet the minimum qualifications of the position, by all means apply for those positions. But if you're just applying because you have a resume, you have a cover letter, and you want to just throw it out there in the universe, it's just not a good thing.
Yeah, and there are, I'm not gonna name names, but there are definitely people that we're aware of that apply for every single job, and they tend to be the first person to apply. And sometimes it's, it's current staff. Like we have staff that are doing jobs that just don't want to be doing them anymore, and they'll apply for everything. And they just get screened out, So I think the other thing to know, at least about, and I can only speak for UC Davis Health, but I anticipate it's probably similar elsewhere, is oftentimes recruiters are recruiting by departments or by industry. So, if you're applying 50 times for the same kind of job or kinds of jobs that you're not qualified for, your name is going to keep popping up. And it's just human nature that somebody who, has a finite amount of time to screen and look at applicants, if they continue to see that same person who's always applying just is not qualified for the role, maybe it would be qualified for something else if they took the time to work on their resume, that they'll notice that. That's never going to disqualify you from a role, but they're aware. So again, what we recommend is taking the time to tailor your materials and not just doing the shotgun approach.
Yes, and we do have, I screen on a daily basis, and I have names of applicants that have been applying for positions that I already know. When I opened the pool of applicants, oh, she or he has applied again. So again, it's and many times I have contacted those applicants and say, hey, you keep applying for this type of positions, but I see that your experience and your expertise lies in this area. I would highly encourage you to apply for these type of positions instead. And they're very thankful for the call, but many times I may not have the time to call every applicant that applies to multiple positions that may not be qualified for.
Yeah, he doesn't have the time. I work Mario really hard. So yeah, that can be challenging. We get a lot of applicants and folks want answers, they want advice, they want insight. And we try to provide that when we can, but to be realistic, I also wouldn't have that as an expectation, that you'll get that concrete feedback or you'll get that guidance when you apply. So a lot of it is just sort of learning strategies, coming to job talks like this and others to get a sense when you have an opportunity about how to put your best foot forward to be considered.
Thank you.
All right, there's another question in there about environmental health and safety careers. Nomara, if you want to start with that one.
Sure. So with environmental health and safety careers at UC Davis, let's see. I'm trying to think of a specific position that may be of interest to you. With environmental health.
Well, let me start. Well, because I have some examples that come to mind right away.
Yeah,
so actually, on the Davis campus, we have, and I worked on the Davis campus previously, we have a really robust environmental health and safety program. So what we have in that arena are a lot of people that work on food safety in particular. So, I worked closely with our environmental health and safety inspector, and her role was to oversee like all of the different dining centers that we had, the food trucks that we had on campus, the student organization events where students would be cooking food in really unsafe ways. And what they do is they provide that expertise around food safety and the science behind that, the biology behind that, the risk associated with that across the organization. And that person's actually positioned as a senior leader because it's such a big concern. If you have one thing go wrong in a dining center, you can get a lot of people really sick really fast. And so it's actually a very high profile and important role at the university. And then that extends beyond that to, like custodial services, facilities. In the hospital, obviously, there's a huge need to have kind of environmental and health safety concerns as a top priority for patient safety. So what you'll find are a lot of leadership roles in that arena that oversee staff who are perhaps working in labs or providing health services as well. So there's a whole ecosystem in that arena, which is why I think Mario was kind of struggling to even know where to start. And then certainly we're looking for leaders that have that kind of science background to lead those different departments.
Well, even I was trying to picture, because I recently hired a director of environmental services, and the reason why we selected this candidate was because he worked very closely with environmental health leaders in the previous or in the hospital that he was working previously, to make sure, especially with COVID-19, to ensure that the rooms for the discharge rooms were kept clean, and the turnaround time that those rooms were clean after a patient left the office. So there's a lot of interrelations with the positions that we currently hire. Again, the Director of Environmental Services working very closely with environmental health to ensure that the hospital it's clean at all times. So
yeah, there's actually a lot of, there's the actual science of understanding how that stuff works, but there's also the project management piece, the leadership piece, organizational excellence and running an effective unit, the business side of it. Oftentimes you're tasked with making decisions about supply chain management and what you're buying in mass. So they're complex and nuanced roles where there's not a single profile oftentimes for these leaders. So I think one of our underlying messages, and this is a good example of that, is that your path as a professional can take you in a lot of different directions. And so I think you're all at a great point where you can start to think about, what you aspire to, and then start to do that work to position yourself to be a great candidate as you move up your career. Don't feel like you're pigeonholing yourself or that you're going to be stuck doing one thing. The leaders that we recruit, there's no one size fits all for these roles. So what we're really looking for are, diverse leaders who bring unique experience, a breadth of experience, but ultimately align with our mission and vision around, serving the public and the public good. So focusing on those types of opportunities are going to really help you stand out as a candidate.
And also too, Lyndon, even starting in an entry level position, I can give you my own example. I started assistant the dean of the School of Nursing, and then a couple of years after, I went into human resources, assisting the executive director of human resources, and eventually with training and shadowing, I transitioned into recruitment and went into nurse recruiting for the nurse residency program for 7 years, which allowed me the experience and the opportunity to now have this role. So you can start at an entry-level position and work your way up to the career that you want to have eventually. And I found my niche, and this is what I love to do. But again, I did not start in recruitment. I went to, my career trajectory took me to recruitment based on experience in department training.
Great. Okay. Well, I know we're at 1 o'clock, so I wanted to provide our contact information. If you have a LinkedIn and you haven't added Mario and I yet, then get on it. Feel free to reach out to us as resources, and then obviously you have Michelle and Samantha as great resources as well, folks that we've connected with. And what I can say about, Mario and I is that we really are, genuinely accessible people. Our goal is to help, and that's really core to our mission in leadership recruitment and diversity services, is to be available. So if you want to reach out sometime and chat about your particular background, your interests, I'll probably send you to Mario if you reach out to me first, because he's better at that than I am. But between the two of us, and then Ellen as well, I'll offer, we're happy to provide some consultation and support. So with that, we wanted to say thank you all for taking the time to spend an hour with us. We hope this was helpful, and I'm sure, we'll have opportunities to engage in the future.
Thank you everyone for joining us today.
Yeah, thank you so